Today's topic is mobile mental health apps for veterans and service members, and we will be chatting with Dr. Julie Kinn from the National Center for Telehealth and Technology, also known as T2. Dr. Kinn is the Deputy Director of the Mobile Health Program over at T2 and oversees the development of mobile health applications to support the military community. Well, welcome, Julie.
Hi, Adam. Thank you so much for having me on.
Yeah, it's so glad to have you here. Thanks for joining us. We'd like to learn a little bit about you and your background and also about your role at T2.
Sure. Well, I am a clinical psychologist by training, and my background is in suicide prevention research. I used to work on the DODSER program, if any of your listeners are familiar with that. And now I have this dream job at T2 where I get to work with a whole lot of psychologists, developers, technical experts, project managers, and stakeholders around the military community to come up with ways that we can use technology to help enhance healthcare, to help patients with self-care, to help educate providers, and help support all of our beneficiaries in a variety of ways. And it's really fun because there's so many new ways that we're using technology these days, and it's getting cheaper and cheaper all the time. And so we're just finding additional interesting initiatives all around that we can leverage to serve our beneficiaries.
That's great. And for folks that aren't as familiar with T2, could you talk to us about some of the health areas that you all focus on?
Sure. Well, T2 is part of the Defense Centers of Excellence for Psychological Health and Traumatic Brain Injury, also known as DETO, and that's under the Defense Health Agency. So we're a sister center to DIVBIC, the Defense Veterans Brain Injury Center, and DHCC, the Defense Health Clinical Centers. So all of us together work on research and practice to help providers and beneficiaries with a whole range of psychological health issues, mostly focusing on PTSD and recovery from TBI, but also reintegration, mood disorders, and general wellness. So it's pretty broad-reaching, and we have a huge range of programs at T2, in addition to the DODSER program, which it helps with surveillance of suicide events across the military. We also do a lot of research, including we have a Caring Letters program. So I was very excited to hear, I think it was 2 episodes ago with Dr. Comtois from UW. But we also do telehealth policy. And then in my section of T2, in the mobile health program, we have a bunch of websites and mobile applications to help our beneficiaries and providers. So, for example, we have websites and mobile apps for families. So we work with Sesame Street to make a big moving adventure app that helps military kids learn positive ways to cope with military move. We have the Military Kids Connect website that helps our military youth feel like they're part of a community. We have our after deployment website, which covers pretty much every behavioral health issue you can think of related to our military community. A couple other websites. And then we also have about 15 mobile apps that folks can take with them on their mobile devices. And for the folks who aren't so used to technology, that means your Android or iOS mobile phone or your iPad or tablet, pretty much anything smaller than a laptop.
That's great. I didn't realize how much breadth T2 has across the DoD system, and in particular, the Sesame Street products have been really popular with our stakeholders and the veterans and family members that we meet at events and whatnot. So that's great to hear.
I recommend that the listeners check that one out. The Big Moving Adventure. It's one that my kids fight over because you get to make your own Muppet. It's a really fun app. And it's a nice demonstration of how you can take what we know about behavioral health and make an application that helps our beneficiaries without just being very dry. There's no reading long descriptions in it. It's just a nice, activating kind of application that's uplifting, mood elevating. And then once we develop this with federal funds, it's out there and can be used many, many, many times over. So ultimately, it's pretty efficient use of funding as well.
Right. And I understand these apps are free to the users as well, right?
Thank you, Adam. Wow, you're really good at remembering all the things I'm forgetting to say. I appreciate that. Yes, All the apps are available. They're all free for the users, and they can be used anonymously, too. So the way a user gets one of these mobile apps is the same way they would get a fun game app, just by going to the general marketplace and searching for it or downloading it or seeing it listed on Facebook and Twitter and the social media programs we've got out there. And what that does, first of all, it's nice that it's free, but it also reduces stigma because they're downloading this app and finding out about it the same way they find out about the new matching game that's popular. So, and also we try to make them colorful and cute looking, not so cute that it's, saccharine, but cute enough that it doesn't feel like this is my therapy homework. So, for example, one of our most recent apps that just came out is called Dream Easy. And it's spelled dream and then space E-Z, sigh.
Right.
But anyway, not my favorite name of an app, but it's still an amazing application. And what it does is it takes imagery rehearsal therapy for reduction of nightmares, which is an empirically validated treatment. And then we have this fantastic application that our patients can use with their providers to engage in this empirically validated treatment commonly for PTSD, but of course for other kinds of nightmares as well, not just those that are co-occurring with PTSD. And when you look at this app, and I recommend your clinicians out there to test it out, kick the tires, let me know what you think, especially if you have suggestions for improvement, because we're always looking for that. But if the user uses it, it's got a nice owl who is the icon. It's visually pleasing. The colors are nice. They're calm. And it looks like a nice professional app, just like they download to track their fitness. It doesn't feel like, here's my mental health app.
Yeah, that's a great point. I'm glad you said that because as much as the content is great, it also needs to look good and feel good and be easy to use. And I feel like you all are hitting all those points here with your app.
Well, we're trying, and part of how we get there is really from feedback. We track every single little piece of feedback, even the misspelled sentences we see on the iTunes rating store. We get feedback from users all over the world, but we take every single one of those and track them qualitatively in terms of the kind of feedback it is, and then try to make as many bug fixes as we can or improvements to the interface. Especially, we love hearing from folks like your listeners, the providers out there and stakeholders who are working day to day with our beneficiaries and have ideas for what would better serve them.
Great. Hopefully we'll get some feedback and certainly we'll pass along if any comments come out in response to this podcast. So I just want to kind of widen our scope and take a step out and say, why mobile apps? What is it about apps that really, specifically for mental health, are sort of breaking down barriers and why are they important?
Well, let me ask you a quick question, Adam. How many mobile devices do you have within arm's reach of you right now?
So actually, I have two, and I probably, if I took a few steps away, I could find a third.
Right. And that's really common. Me too. I'm talking to you on a cell phone. I've also got my BlackBerry, but I've got my Kindle not too far away. And I'm sure if I rounded up everything in the house, there'd be a nice armful. And that's pretty common, especially with, I'm in the DoD, so our beneficiaries range in age, but are mostly on the younger spectrum. So especially for them, we estimate definitely above 90% of folks own their own mobile device. And more than that, they sleep with their mobile devices. And what I mean by that is they use mobile devices, and I do this too, so I should say we use mobile devices for our alarm clocks. So as soon as I wake up in the morning, the first thing I'm interacting with before my dog, before my spouse, before my toothbrush is my mobile device. And this is very common for our service members and our veterans, and it's becoming more and more widespread every day as they're becoming more cost efficient. These days, it's a lot cheaper to buy a cell phone than it is a computer. And so even for our veterans and service members who don't have a lot of extra financial income, it makes sense to have these devices. So at any rate, we're seeing they're commonly used all over the place. And the way our beneficiaries are using them is like a third arm. I know our patients, when they don't have a device on them, they feel like half of their memory isn't there. They don't trust themselves to remember things. They want to write it down on their phone. They want to record everything there. They want to take pictures. Recently at a conference, a lot of the younger folks who I met didn't want my card. They just took pictures of my card with their mobile phone. And more so, did you see that too, Adam? Or were you one of the people taking pictures?
Well. No, I've been on both ends of it, actually, because you end up with this pile of cards at the end of the conference that, you can at least have them organized as photos. So, yep, I've been there.
Yeah, but a part of it, especially with regard to healthcare, is that we're seeing huge amounts of our beneficiaries, and I'm saying huge because I don't remember the numbers offhand, but I can get you this information later if you'd like, and we can share it with your listeners. It's very common to engage in management of health using mobile devices and websites. So, for example, I asked your listeners, imagine your kid comes home with a weird-looking bruise, and it doesn't look like a normal thing. You don't call the emergency room right away. You don't call your doctor and ask for an appointment right away. You look it up online. You do Google image searches. You look on common medical websites to diagnose your symptoms a little bit before calling in. And that's fantastic to see patients engaging like that, to engage in their own health and be activating. Of course, there are some problems there too, but we're seeing patients do the same thing with mental health, with behavioral health. And so what we are trying to do is use the evidence we've got to make excellent applications and websites so that as someone says, I wonder if my partner might have PTSD. What is this PTSD thing I'm hearing about? That we have that evidence-based, well-written resources out there to help them dip their toe into the waters of behavioral health treatment.
Yeah, that's really helpful. And I know, particularly like in our region and other places across the U.S., a lot of folks are in rural areas or maybe further away from the treatment center, and being able to pull something up online and get that at least initial information right at your fingertips is really powerful.
Absolutely. And so for us, the products we're putting out, and I know this is true for the VA as well, all the products, especially the ones that deal with depression and PTSD and mood elevation, have links to things like the DECO Outreach Center or the crisis line. These apps are not meant to be used just all on their own. They're not treatments. They're ways to get folks into treatment. They're ways to educate our beneficiaries about what treatment looks like. They're ways to help them engage in behavioral health homework in between sessions and to help with termination. They're not a replacement, but hopefully an adjunct.
I'm really glad you said that because, I want to make sure it's clear the purpose of these apps and what the appropriate way to use them so that they are the most helpful for our patients and our end users. Just taking, for example, the Cognitive Behavioral Therapy for Insomnia Coach, which is the CBTI Coach for short. That's an example of one of your apps that you do recommend augmenting face-to-face visits. Could you go into that a little bit?
Sure. And first of all, I want to give credit where credit's due. The CBTI Coach app, which is fantastic, is a VA app. We helped out with it just a little bit, and we promote it widely. We have it listed on our website, and we talk about it all the time because it's such a fantastic app, and it uses evidence-based treatment. And when the team made it, they reached out to experts across the United States to make sure that it provided the best help for CBTI treatment. This is an app that's meant to be used with a patient and a provider, similarly to the Prolonged Exposure Coach, where it includes homework, it includes activities. Now, since these are available on iTunes and Google Play, if someone downloads it and they're not using it with a provider, it's going to have limited utility, but there's still an educational component of the app. They can still learn about what is this CBTI stuff, and then that ultimately, hopefully, will help lead them to call a provider to engage in treatment.
That's really helpful because I feel like that encourages users still check it out, still look into it, still learn what are these things, what is CBTI, how can it perhaps help me with my sleep. But knowing that, then the next step from there is reach out to your service, your providers, and figure out how to get involved in further care.
Exactly. So our apps fall into three different kinds. So we've got that kind, which are ones meant to be used by beneficiaries with their providers, like CBTI Coach, Prolonged Exposure Coach, the Dream Easy app that I referred to earlier. And then we've got ones that are for self-care and monitoring of symptoms. For example, the T2 Mood Tracker app, one of my favorites, where a user can very easily track a whole range of symptoms that are common behavioral health issues, but also can add their own. For example, if you think you're eating too much peach pie on a daily basis, you can add a little measure on there for how much peach pie am I eating, and track it and graph it across time, and then compare that to your depression, and hopefully notice across the week, hey, on the days I'm not feeling so great. Those are the days I'm eating extra peach pie. Maybe that's related. So that's a nice app that can still be used with a provider, too, because the patient can bring it to session and say, hey, I had this great realization regarding my peach pie issue. But also T2 Mood Tracker can be used by someone on their own, because most of our apps fall into that category. And then we also have applications and websites that are meant for providers to help them find training and education opportunities, learn more about these treatments, and also to monitor their own emotional well-being. For example, our Provider Resilience app is meant to help prevent burnout and compassion fatigue.
Yeah, I'm so glad you mentioned that. Sometimes work is a stressful environment, and our providers need to have tools at their hand as well to take care of themselves. I know one of our previous interviewees kind of commented that in the healthcare field, we often take care of ourselves last. How important it is to sort of put our own health first. Could you tell us a little bit more about that Provider Resilience app?
Sure. Provider resilience, it's such an important topic for everything you just said there. And it tries to address the two sides of the provider resiliency coin. One side is compassion fatigue, putting so much of yourself out there that you might start experiencing secondary post-traumatic stress, having difficulty leaving work at work, finding yourself having nightmares or intrusive thoughts based on things that your patients are telling you. So that's certainly resilience killing. But then the other side of the coin is we see some folks start to shift away from their work and become hardened to it after hearing so much. Provider resilience tries to help build insight about both burnout, emotional reactions to working with PTSD and other very difficult areas. It includes a vacation tracker, exercises that one can do in the office, physical isometric exercises, and other activities that can help build resilience and awareness, including a lot of self-assessment. But I also want to say right now we're thinking of ways to revise provider resilience. This is one that, like I mentioned before, we constantly have a backlog of ideas for how to make these apps even better, that mobile apps and the website. And this is one that right now we're actively coming up with ideas for. So once again, I will put in my plug for feedback from your listeners. If you have suggestions for us for what would help you remain a resilient provider, let us know. I'd be thrilled to hear your suggestions.
Mm-hmm. I'm glad you mentioned that idea of awareness as well, is because similar with the mood tracker and just this idea of raising awareness of your own state and then therefore being able to use these tools to sort of help yourself cope through that.
Right, exactly.
Within the suicide prevention community, one of your apps that's gotten a lot of attention is the Virtual Hope Box. We are really interested in that one as well, and could you tell us about that?
Well, first of all, I think we should do a follow-up episode just about the Virtual Hope Box and the ways it can be used for self-care and also treatment, because it's such a tremendous app that was a great collaboration for VA and the DoD, and we've got some exciting research coming out about it. So I'll just put in that teaser, so something to think about, Adam.
We would love to do that, of course.
Okay. I think Dr. Nigel Bush with his British accent would be fantastic on your show, by the way. So at any rate, the Virtual Hope Box that can help with mood elevation. And it's one of those fantastic apps that's good for self-care, but also can be used as part of therapy treatment. It's based on the old Hope Box idea of you get a shoebox and you fill it with tangible things that elevate your mood. Maybe it's photographs of happy times or a cassette tape of your favorite song. And these days, our mobile device can fill that same technical requirement of being able to house your favorite pictures and your favorite songs and links to your favorite cat videos even. So we developed this very colorful, fun app that has 5 different sections. One section is just a Remind Me section, which reminds the user of all the great things that are going on. They can add vocal recordings of themselves or others telling them good things, reminding them of why they're a good person or whatever kind of message will help them with their particular behavioral health concern. We've got a Distract Me section that includes fun games and little things like Sudoku and word search, which are nice for when you need to take a little emotional time out. I've used that one before when parenting. There's a Relax Me section, which is very popular, that includes a diaphragmatic breathing trainer similar to our Breathe to Relax mobile app, which, by the way, just hit the 1 million download mark. So your users should try that one out. Or your listener.
Wow.
Thank you. Yeah, your listeners should try that one out too. It's a fantastic app. And so it has a breathing trainer and guided meditation and relaxation exercises. So let's say, did relax me, distract me, remind me. There's a, golly gee wilkers, what are the last two? I need to look at that up. Bill, you want to jump in? Let's see. I'll get there. There's a section for connections to have a support network, including helplines. And then there's a section that includes coping cards and fantastic quotes and things that are all, again, very uplifting, but can be used as part of a treatment. A coping card is our technical version of the old note cards we'd have our patients fill out. Or I shouldn't say old. I still do this in treatment. The note cards that we have them fill out of an activating event and the emotional consequence and a different kind of behavior that they can do instead, or a different kind of thought that they can have instead to elicit the different behavioral response. And you can do this using the app and then flip through them. So you can make a coping card for angry driving, for example. Now, this app is fantastic because it's one of those colorful ones that has a lot in it that can serve people in different ways depending on their different needs. But we've been using it at Madigan Army Medical Center as part of our intensive outpatient program, our IOP groups. And in the group setting, we walk through the virtual Hope Box with the patients, and they set it up and they use it, and we've had some nice success there. So this app has gone far beyond what we imagined when we first started building it. And we get feedback from our users constantly saying, giving us just the unique ways that they're using this app that we never would have thought of.
Yeah, and I've definitely given that one a little test ride and used a couple of the features, and I was really impressed. I did some of the guided relaxation exercises. Just, again, this usability, it felt very natural to navigate. It wasn't hard to find what you wanted. And then, as you touched on, it has this hot dial to the crisis line, and I think, that's important. Perhaps somebody, when they are going through a crisis, fumbling for the number or figuring out what it is, it can be a challenge. And having just that quick, easy button within the app, I think it's a really, really strong point of it.
Thank you.
So just shifting gears a little bit from the T2 website, I noticed links to this RX prescription pad for mobile apps. Can you tell us about that?
Yeah, this is a fun product that anyone can download and print these out. What we're trying to do is get providers to think about technology as something that can be prescribed. Just like we prescribe exercise or medication or homework, you can prescribe mobile applications or testing out a website. I'm not saying that technology is ideal for every patient or client, but for some it absolutely is, especially for your patients who are carrying around mobile devices with them and already using them to monitor other aspects of their health. So we made these little prescription pads so you could just circle the apps you'd like your patients to try out and hand it to them just like you would any other kind of prescription.
Great, and we'll definitely put a link to that along with the post here.
Thank you. Yeah, I'd like to see maybe 5 years down the line, or maybe 10 years, a provider to say, okay, what are the prescriptions that are going to be helpful and what are the technology resources that are going to be helpful for this patient? It's just a different way of looking at our treatment as usual.
So you mentioned, perhaps patients have their smartphones with them while they're seeing a provider, and then they could be perhaps prescribed to check out an app. One of the questions I've gotten is, obviously you need some kind of internet service or data plan to download the app. Do you need internet while using the app?
For some of them, there are some features connection makes necessary. For example, in our Life Armor application, there's a few videos that a user can click on. Those require internet connectivity. But for the most part, they don't. It's something we're aware of, especially within the DoD. We have folks who are shipboard or work within a hospital setting or other areas where you just can't have your internet going or it's cost prohibitive. So for the most part, you don't need an internet connection.
So that's really helpful because, as you mentioned, there's various reasons why you might not have internet, from the cost of the data plan to privacy needs. There's certainly public areas with Wi-Fi that somebody could go to download the app and then use it offline. If they don't have service in their mountain home, they could still certainly make use of the technology.
That's exactly right, yeah.
Great. So that's kind of a segue into what the app collects and how it uses the data. Some of our consumers raise legitimate concerns about just the safety of their data, and particularly with mental health and behavioral health information. This is private information, and folks want to know that their data is safe. Could you speak to that a bit?
Yes. Right now, none of our applications collect identifiable information. The only thing we know is aggregated data. We can tell from the iTunes Store or from Google Play how many people are downloading our mobile app. And for the websites, we can tell how many visitors we have and which sections of the website they're going to. And we can also guess where geographically they're located in terms of city-level data. But even that's dependent on how their internet connection is enabled. So we don't know who's using these applications. They're used anonymously. Nothing is reported in their medical records unless a user emails me with their name and telephone number. That's not information I'm going to have. Security is extremely important to us. That's a little limiting, too, because it makes it so that our providers can't necessarily see what a patient is doing with a mobile application or website unless the user brings it to the session. But we made the decision that security of data is probably the highest concern, and so we've enabled them only for anonymous use.
That's really reassuring. And sorry, keep going.
Also, on the mobile device themselves, our data is very secure, and the applications such as PE Coach and T2 Mood Tracker include an additional optional PIN passcode so that even if someone picks up your mobile device and knows your mobile device passcode, they still can't access your recordings on PE Coach, for example, which is highly sensitive. But I'd recommend to your listeners, this is something we say in our trainings, that you also add PIN code to your overall mobile device. That's just good security.
Absolutely, and that's, again, very reassuring to hear. And the security is important, and it's comforting because, then it allows people to really download and feel safe using the apps, and especially knowing that it's coming from a reputable, from the T2 organization, part of the DoD. So we can really feel safe downloading these apps and knowing that our data is being securely stored locally on the device.
Yeah, here's another topic for another podcast if you'd like, on just general security beyond just the T2 and VA apps. But I'd recommend to your listeners, especially if you're suggesting that your patients use mobile applications or websites, that you kick the tires first and also look up who is making the application and what's their financial model. Every iTunes account and Google Play account with any mobile application lists a website for the maker. Check it out. See who made that application. Check whether they're in a country that might not have the best security regulations or if there's going to be hidden costs down the line for your patients. I'd be very cautious to recommend any mobile app that's not made by the federal government or that you haven't tested out yourself.
Absolutely, and that's, I think, great advice to share with the audience. Another thing I think we share across the Rocky Mountain MyRec and T2 is this goal of really trying to keep our providers and our patients and our veterans and their families really informed and up to date about the latest advances. And you've already sort of talked about the Dream Easy as a new app that just got released. What else is on the horizon or has recently come out that is really exciting and is going to help with mental health or resilience?
Well, we've got a lot of potential applications that I can't speak to yet, but I will tease your audience by saying we're looking at some interesting ways to improve our existing applications with some features that I know our users have been clamoring for. And I think our users will be really pleased with that. I know that's such a vague answer. My apologies, Adam. But I'll also say that for all of our application ideas, for new apps, we meet with providers and beneficiaries to come up with the ideas. So we're looking at some of the large behavioral health concerns that we know are really urgent needs within the military community. So I guess my best advice would be to follow us on Twitter at T2 Health and follow us on Facebook, also at T2 Health, and to visit our website at t2health.dcoe.mil so that you can see these new applications as they come up, and you can be the first one on your block to have the cool new thing. Beyond that, I can't get into it too specifically, but we do have some really fun things planned for the next year.
You've given us a lot of information today. Any sort of ways to sum it up or closing thoughts for our listeners?
Well, I guess my parting wisdom would be, even if you don't find yourself strongly engaged in technology, know that your beneficiaries are, and consider ways that maybe you can learn a little bit more about it and test things out on your own. And for those of you who already are using mobile technology, keep learning about the newest and latest and greatest. Come up with the compelling, interesting ideas, and then let me know what you think. I'd love to talk to you about ways we can use these technologies to help our beneficiaries in hundreds of ways.
Great. Well, Julie, thank you so much for the work you're doing to help the military community and also all your coworkers at T2 that make this all happen. It's really fantastic to hear about.
Well, thank you, Adam. This has been really a pleasure.
Well, that'll be it for today, everybody, and thank you all for listening. You can, of course, learn more about Dr. Kinn and all the great work going on at T2 by clicking on the links accompanying the podcast. Again, as Julie mentioned, we'd love to have you reach out to us, comment about any of the apps that you've used or just any other thoughts about today's podcast, and take a moment to subscribe, give us a review, and share with your colleagues. Until next time, this has been the Short Takes on Suicide Prevention podcast.